All right, good morning. Good morning, everyone. Okay, there. You guys hear me clearly? All right, I'm having a little connectivity issues today, so my Wi Fi is not working as good. But if everyone could hear me, can you guys give me a thumbs up? Let me see. Hello? Alrighty. And of course, you can always use the comment section if you guys can hear me clearly. We are going to have an NCLEX class today. All right, I think we have nurses joining us from Gladys. All right, Adrian could hear me very good. Gladys is here. Annalisa is joining us from Southern Leyte in the Philippines. Very good. Jester, Adrian, thank you for joining. Olivia, Rosalie, hi. Olivia is joining us from Bangladesh. Hi, Olivia. Letty is joining us from Zamboanga City. All right, where is everybody coming from? Apple. Lerma is also here. Apple is joining us from UAE. All right, Lyra is here from Philippines. Brits is joining us from UAE. Thank you guys for joining. McCoy is joining us from Bacolod. All right, and Adrian is joining us from Dublin. All right, thank you guys for joining. All right, so today we're starting a little late because it's actually not a little late, a lot late because I was having connectivity issues with my Wi-Fi today. All right, and the raffle. All right, we are going to announce the raffle after the class. All right, if you guys are member of my Facebook broadcast channel, all right, if you guys are members of my Facebook broadcast channel, all right, I'm gonna announce the raffle link there later. All right, if you guys are still not members of my exclusive broadcast channel, then I will post the link to the broadcast channel, all right, later after the class. Okay, is that good? That way I know who actually joined during the live stream, because you guys are gonna see the link immediately after the show. But anyway, but yeah, I do have an exclusive broadcast channel that I use to send information, exclusive deals, raffles, live streams, all right, and just random messages to my followers in Facebook, all right? Who among you guys are already following me in my broadcast channel? That's on top of my page. I know you guys are following my page because you're here in my page today, but I do have a broadcast channel as well, and almost 2,000 members there. But I will post the raffle link later, right? If you guys are still not members of my broadcast channel, all right, I will post the link later after this class. So you can join the broadcast channel and then from there find where the raffle is at. Okay. And all right, Iris is joining us from the Philippines. Thank you, Iris, one of my followers. I always see you in the live stream. Nelia is watching us from Riyadh. Hi, Nelia. I think you're one of our raffle winners, as well as Adrian in the past. Ellen as well. All right, watching from Illinois. Chicago is one of my favorite American cities. And I know it's cold up there in the north right now. Here in Texas, it's not that cold. Pauline is from UAE. Okay. All right. So we're gonna talk about next gen NCLEX. Kind of zoom your screen a little because this will be a long case study. This will be interactive. Okay. And before we start, I would like to announce that we are running a 60% off. All right. We are running a 60% off on all my classes. All right. 60% off on my full course for my birthday. My birthday is this weekend, but because I started a new job, I'm going to be a homebody for my birthday. It's the first time I haven't traveled for my birthday for a long time, but it's okay. I have my puppies here. My birthday is this Saturday, so everyone who are celebrating with me and wants me to help you guys pass the NCLEX, I would gladly help. I am here to help you guys reach your American dream. And NCLEX is not only for the NCLEX, all right? I'm sorry. And NCLEX, I'm sorry, what did I say? NCLEX is not only for the US, all right? NCLEX is also good for Australia and Canada, and it's also good for many things, right? It's also good for, if you want to pursue your American dream in the future. Some of you guys are NCLEX passers already, but are not yet here in the US, and that's totally fine. But NCLEX is very challenging, and we have quite a bit low passing rate for international graduates, and that's why I have Aspire RN, the Doctor Nurse Paul method. My goal is to help you guys pass the NCLEX. And right now we are offering it 60% off, Zig Zero, all right? 60% off. So I think the regular price is 550, all right? And now it's down to 220. This promo is only until, I think they've extended it until, I think it's until tomorrow only, all right? Until October 24. So talk to my marketing team, send me a message in my portal or in my page right now. One of my team members will talk to you, all right, and see if we can extend the promo for you. This is very limited only. All right, we've run it about a week ago for my exclusive broadcast channel followers, and we've already had a lot of enrollees. So I'm just extending it a little bit for you guys that are joining me in live class today. Or if you're not interested, you already passed the NCLEX or you've already enrolled with my program, do kindly tell your friends about my course. All right. I've helped a lot of nurses pass the NCLEX, been teaching for 16 years, and today is one of those free classes that I do for the community. All right. So if you guys can do me a favor, all right, can you guys share this class right now to your pages? All right. Can you guys share this class today to your pages? Okay. Can you guys share this class right now to your pages? I'm trying to see how I can increase the size of this thing. All right. That way we can have a much bigger screen for you guys. I think I might have to edit that. All right. And see how we can expand the screen. But it looks like it's not doing it. All right. Okay. Any questions before I start? This is going to be another case study. All right. So I'm excited to do this with you guys. I haven't done it for a long time. I was going to do it this Monday, but I started a new job as an urgent care practitioner, nurse practitioner. So kind of busy last weekend and this week because of the new job. And it's also my birthday week. So really busy with adjusting to the new job. And, first week usually is all about computer stuff and education. So lots of things to do. It's more computer side than clinical side, right? So let me share this screen again. See what's going on. All right. I think that's the biggest that I could bring the screen in. I might also be able to expand it like this later. All right. Thank you, Sherilyn. All right. Okay. So you guys ready for the next generation NCLEX class? Again, 60% off for my courses today. All right. Today only. We have 60% off. All right. And I'm trying to look for my camera. There you go. $220. Send me a message today. You have 24 hours left to join my course. We are also offering installment payments for those nurses that are unable to pay the full payment. So it's already 60% off, and you can also pay it in installment. Talk to my team right now. Send me a message in my Facebook page and in Aspire RN Facebook page. And we are going to help you, run you through how you can enroll with us and reserve your spot. Hello, Dipali. Thank you. Dipali is one of our followers, and she also recently enrolled in Aspire RN. Thank you. Alrighty. So let's talk about next generation NCLEX. All right. So for next generation NCLEX, guys, next generation NCLEX is the new version of NCLEX, which started last year, April 1. I like it because it's very interactive. So there are two versions, right? The standalones, which are trends or bow ties. We're going to cover that in one of the free classes. All right. And the case studies. I love case studies. Case studies are like reading a story about a patient, evolving story about a patient, and you get to answer 6 questions per case study. So one case, one disease, one disorder, or one condition, or one situation, and then we get 6 questions out of that. I like it because it's like reading a story, reading a chart, reading on what's happening with a patient who has joined my previous classes, right? Who was able to join my previous classes? I think I did one last month and another one last August. If you have not joined my previous classes, all my videos are available in YouTube and in Facebook. I think it's going to be easier to watch it in YouTube because it's archived in folders, whereas Facebook don't have folders or something. All right. But yeah. So next generation case studies. I do usually every month I do free case studies. All right, free case study classes. And for my students, we always do this a lot. Every month we do about 50 case studies or something, right? Julie Ann, hello. Thank you for joining me last time and joining again. All right, so kindly tag your friends so they can join us as well. All right. So for case studies, question number 1 would always be about recognizing cues. Question number 2 would always be about analyzing cues. Question number 3 about prioritizing hypothesis. Question number 4, generating solutions. Question number 5, taking actions. And 6 will be about evaluating outcomes. So we're going to see your nursing knowledge today. Let's see if we can test your nursing knowledge. All right. A lot of you guys are still working bedside. So that's good with case studies because it's real life. We kind of like mirror real life scenarios so we can actually evaluate or measure your clinical judgment skills. So next generation NCLEX is all about clinical judgment. All right. And let's see this. All right. This is our case for today. All right. Everybody who's ready to do the case study today, say, yes, I can. Say, yes, I can. Can you do that? All right. Thank you for tagging your friends. Everybody who's ready to join the case study today, all right, and start with the case, say, yes, I can. I love the word, yes, I can. It's like my little positivity words of affirmation that I usually tell myself every day when I wake up, all right? Yes, I can. Very good. Okay. So let's see. And here is the case. All righty. All right, you guys see it, right? And my video is going to be at the bottom side, all right? A nurse in the emergency department is caring for a 17-year-old male client, all right? History and physicals denies short of breath, okay? And what's going on here? We see reports discomfort in the lower, I'm going to mark that, okay? Reports discomfort in the lower side of the chest, right? And taking a deep breath, all right? So let's delete that. Okay, discomfort in the lower side of the chest when taking deep breaths, all right? What else? We have abdominal fullness here for this guy and feeling nauseated as well. And the history has this, an injury to the left rib cage, all right? After being struck mechanically by a baseball bat last week. There is intermittent pain, left shoulder, 6/10. Numerical rating scale feels lightheaded, right? Bruising to the shoulder. There's left shoulder rotator cuff last year, or that was last year. So that's probably not a problem right now. What else? The client has not felt well enough to attend baseball practice since the injury. So not feeling well enough to attend baseball practice since the injury, okay? So what else did you notice on the screen? Aside from history physicals, do you see other tabs? Yes or no? Do you guys see other tabs? Yes? Yes? Okay. So let's check your nurse's notes, all right? For the nurse's notes, let's read, okay? Oops, sorry about that. Oops. All right. So for the nurse's notes, the client appears pale and slightly diaphoretic, correct? Slightly Diaphoretic. That's not a good sign, considering all things that's happening with the patient. There's large amount of bruising in the left torso and the LUQ, left upper quadrant, right? Of the abdomen. Tenderness, there's guarding, there's dullness to percussion. What else? There's also diminished breath sounds. We don't like that, right? In the left lung fields. Client has productive cough. I would start writing, guys. I know it's a lot of stuff or assessments going on today. Remember, question number one or clinical judgment question number one would always test your ability to recognize cues. So it will be talking all about assessment findings, correct? Assessment findings. So these are your assessments. We are seeing a lot of abnormal signs, correct? What else did you notice? Is there another tab? Yes? Is there another tab? One of the techniques I tell my students is when you're doing case studies, you start writing on a piece of paper. In the actual NCLEX, they will give you a writing sheet or writing pad. You can start writing all these clues, all right? Why? Because that will help you in bullet format, all right? That will help you, right, identify the case in a much quicker way, reading all the bullets versus reading the case study again. Because remember, there are 6 questions about this case, right? So you might be wanting to look for what you found earlier, what was your vital signs earlier, what were your assessments in the abdomen when you're already in question number 6. So you don't want to be reading the same stuff over and over again because you're also time limited in the NCLEX. Vital signs, what did you guys notice? What is abnormal in your vital signs? What's abnormal in your vital signs, guys? Come on. All right. What I don't like about the vital signs is I have tachycardia there. Yes? Yes? Can you guys follow? Yes. Respiration's 24. Correct? Correct? And blood pressure is 90/50. So you have low blood pressure, increased RR, increased PR. Good thing we still have 98% on room air. Agree? Yes? So what are we seeing? Are we already seeing signs of hypovolemic shock? Possible hypovolemia? Yes. With the patient's condition, there might be some form of trauma, right? Because if you look at the history earlier, he was hit by a bat, right? And for those who just joined us, there's sudden rush of new viewers that are joining. We're doing next generation NCLEX class today, and good for you. We're in question number 1, all right? Question number 1. All right, let's look at the labs, guys. Let's look at the labs. And look at the labs. White blood count is elevated, all right? We don't like white blood counts elevated, right? Either you have infection or inflammatory processes that's going on. Guys, what did you see in the hemoglobin and hematocrit? Your H&H. This is one of the things we quickly check in case of trauma to look for possible signs of bleeding. Do we have low hemoglobin? Yes or no? Yes or no? Do we have low hematocrit? Yes. Are these both signs of bleeding, possible bleeding? So we not only have a trauma, a possibility of trauma, but we're also developing bleeding somewhere, all right? Possibly related to trauma. Agree? Yes? Yes? And what did you guys notice in your next generation NCLEX? The good thing with your next generation NCLEX, you now can see your normal values, all right? So there is less emphasis in memorizing your normal values because you now can see your normal values in your actual NCLEX, okay? You got it? All right, now we're ready to answer question number 1. This is only question number 1. Which of the following findings require immediate follow-up? Go. Select all that apply. And when we're answering select all that apply, guys, this type of question now is right minus wrong, all right? That's our formula for your score. Right minus wrong. So for every wrong answer that you get, you also, for every wrong answer that you click, all right, or wrong option that you click, you get a deduction, all right? You get a deduction. So be careful. So tell me your answers. Tell me your answers. Come on. We have 7 options. Considering all things that we've read so far about this patient, we have some abdominal symptoms, we have some respiratory symptoms, we have signs of hypovolemia, abnormal H&H and white blood counts, history of like a baseball injury about a week ago. All right. Cheng already has an answer. I want more answers, please. All right. If you guys are watching this, can you put a heart in Facebook? That way I know how many of you guys are watching. Actually, I can see how many. But I just want to know if you guys are actually live and participating here. Send me some love. All right. Heart. All right. Or whatever reaction. Hopefully not the angry, sad button. All right. In the reactions in Facebook, and tag your friends as well so we can have them join here today. All right. We now have about 80 viewers. Wow. All right. Considering I started late, I'm sorry about that, guys. All right. So let's see. What are your answers? I've only seen a few people answer so far. This is going to be interactive. I want you guys to participate. I know the answers here, but I want to see how you guys answer so I can teach you some strategies. Pauline already have answers. Thank you for those who are participating in Facebook. All right, and some of you guys are already my students in Aspire RN. All right. Um, we have diminished breath sounds earlier. So are we going to check lung sounds? Definitely yes. All right. Shoulder pain. Okay, there is a shoulder pain, but I don't think that's a problem right now. Correct? I'll focus more on ABCs, airway, breathing, circulation. Correct? So shoulder pain, while it is abnormal because you shouldn't have shoulder pain, nobody dies from shoulder pain, right? If I have an emergency client that's having hypovolemic shock, trauma code, right, I would not focus on shoulder pain. That's probably just one of my secondary assessments, but not a priority right now. So we'll skip shoulder pain. How about lab results? Definitely, all right, because we've flagged all three of them. All right. Do we have productive cough? Do we remember if we have productive cough? I think we don't have productive cough. Remember, we're gonna go back to the nurse's notes, all right, and see if we have productive cough. I don't think we have productive cough in there. All right, I may be wrong. There's diminished breath sounds that go to your respiratory. It says denies short of breath. There's left side chest pain when taking a deep breath. There is no productive cough. So I'm not gonna check that. All right. So let's see. So we have lung sounds again, lab results, abdominal assessment findings, definitely, because we have bruises, pulse, respiration, and BP, correct? How about temperature and pulse oximeter reading? I think they're normal, right? Temperature, pulse oximeter, and reading, correct? So our answers are 1, 3, 5, and 6. Who got 4 points? I see some of you guys got 4 points. Very good. All right. If you got 3 points, like Asuncion, she's answered 1, 5, and 6, and Feed 1, 5, 6, you guys get 3 points. That's still good. All right. Better than 0 points. All right. And for the rest of you guys, you got 2 points or 1 point. That's totally fine as well. So long as you did not answer 2, if you did answer 2, you get a deduction. If you answered 4, you get a deduction as well. And 7, you get a deduction. Alrighty, you guys got it? That's our warm-up question. That's our warm-up question. All right, let's now go to question number 2. So same situation, nothing was added to the situation. Nothing was added to the situation, all right? Now the question is, for question number 2, remember question number 2 in next Gen NCLEX is analyzing cues, all right? It's, again, select all that apply. So right minus wrong, be very careful, all right? Which of the following issues is the client at risk for developing? We're now talking about risk for complications. What are these? All right. Can you guys tell me your answers? And thank you for those who are participating and those who are passively participating. All right. That's totally fine as well. Do not be afraid to make mistakes. With classes like this, I actually encourage nurses to be interactive. All right, we learn more with interactivity. All right, especially for the audiovisual learners, kinetic learners. You learn better this way. All right, and plus it's easier to remember things that you got incorrectly. Correct. So I tell my students in my class, don't be afraid to to make mistakes, to answer incorrectly, because then I have a chance to correct that before you take your NCLEX, correct? So don't be afraid. Be interactive. Join the class, all right? Write your answers. Pauline already has her answers. How about the others? If this is your question in the NCLEX, all right, and um, hold on real quick. My browser is having issues. All right, there. What will be your answers? This is a select all that apply. Anyone? Aside from Gene? All right. And again, quick plug only because there's a lot of new viewers. All right. My classes are down to 60% off. It's my birthday week. My birthday is this Saturday. I'm celebrating my 18th birthday. We are going to do we are going to bring down my classes to 60% off. This is the lowest I've ever offered my class. 60%, 60% off, right? From $550 to $220. $220 only. Plus, you can also avail installment, all right? And I think the last day will be tomorrow, October 24. All right. If you are not ready to pay, but just want to reserve your slot, because the slot is limited, 40 people already grabbed the slots. We're trying to limit that way. We don't like 1,000 people enrolling at the same time, right? Because, of course, it decreases my quality. All right. I'm more for quality than quantity. So if you are interested, talk to me, send me a message today, right now, or after this show. All right. And then we will extend or give you extension or something like that. We'll work with you. In short, there's also installment payments. All right. But that's it. All right. I'm just letting you know that we are offering the class 60% off on all my classes. So we have 98% pass rates. We have 98% pass rate. We've helped a lot of nurses and they're already here in the US. All right. Kaching, just follow us for future classes. I do a lot of med surge classes. I teach all med surge. All right. But anyway, that's it. 60% off. Send me a message if you guys are still not aware. Send me a message. Those who are members of my broadcast channel, you guys got the first dibs with the raffles. You guys get the first dibs with the promo. All right. So there's an advantage of joining my broadcast channel. I'll also announce that later. But guys, 60% off. I've never offered that low before because we have very high quality review program. But I am going to bring it down for you for my birthday week. All right. And I think my marketing team has put an extension until tomorrow only. So you have 4 more hours to reach out to me. All right. What's your answer here? All right. So do we have a risk for stroke? We're going to skip stroke. We're focused on trauma and bleeding and shock and all that. Do you guys think there's a possibility for, say, hemothorax? Yes. Because we have like breathing issues earlier, diminished breath sounds, right? There's like bruise in your left upper quadrant. So we're thinking it might have hit the lungs as well and possibly hemothorax. We cannot rule out hemothorax. In traumas involving chest or close to the chest, right, upper abdomen, you cannot exclude hemothorax, which means we have to assess for it. We have to make sure that there's no hemothorax. And that's a quick test, guys. That right? We just do a CT scan, correct? See if the lungs are fully expanded, correct? So we do, I mean, not CT scan, I'm sorry, chest x-ray, portable chest x-ray in the ER. We just bring the portable x-ray there, have the radiologist RT take your x-ray, and that's it. All right. How about bowel perforation? Is there a possibility of bowel perforation? Bowel perforation is not really traumatic. It's more medical, right? Is there obstruction? Is there inflammatory diseases, ulcerative diseases in your in your abdomen. So I think I'm gonna skip that. I'm gonna focus more on trauma complications. I'm gonna talk about splenic laceration. Correct? Correct. But also, we don't. I don't see a lot of symptoms for pulmonary embolism. Usually, there's shortness of breath and dizziness and chest pain, and oxygen saturation would be really low. So I don't think pulmonary embolism is a problem right now. I'll skip that. I'm probably gonna check. Let's see, abdominal fullness, nauseated. I'm probably not gonna check abdominal aortic aneurysms as well. All right. So for me, I'm just gonna answer 2 and 4. Okay, because for abdominal aortic aneurysm, I'm gonna look for more symptoms. Right. I'm looking for pulsating abdominal mass. I'm looking for severe abdominal pain. Correct. But I mean, we have left upper quadrant pain. Usually, triple A is midline. All right. So it's probably low in my differentials. All right. So I'll answer 2 and 4 for now. All right. Don't miss splenic laceration, guys, because you have left upper quadrant pain earlier. Okay. So a little tricky, but you want to be as specific to the case as possible. There are multiple possible answers, but because of the case, we're gonna choose hemothorax and splenic laceration. All right. So basing on all the situation, we're now in question number 3, or prioritizing hypothesis. All right. This type of question, by the way, guys, is called drop down. All right. So drop down. If you click that, then you see options. All right. You see the options. What is the answer? What would you assess first? You have abdominal pain, you have respiratory status, you have labs. All of these, you have abnormal findings, right? In abdominal, you have your abdominal pain, left upper quadrant bruising, left upper quadrant pain. Patient is not comfortable. In respiratory, you have diminished breath sounds. In lab results, you have abnormal H&H, abnormal WBC, right? So all of these are abnormal, but you're choosing a priority, which takes priority. Cheng already has an answer. How about the others? I want to hear from more people. And also, Kuching, thank you for greeting me my 18th birthday. This is the 20th year I'm celebrating my 18th birthday. So if you do the math, I'm 38, not getting younger, getting older and getting wiser as well. All right. When I was young, I wanted to grow up fast. Now that I'm getting older and all these neck pains and back pains and tummy aches are starting to come out, and now all these abnormal labs are coming out, you're having high cholesterol and all that. All right. And my metabolism is slowing down too, so I'm gaining weight. I was out of work for 3 weeks, right? So all I did was eat Filipino food and desserts. Oh my God, it was delicious. Kind of like stress eating. Not really, because I feel like I was on a vacation for 3 weeks, right, in between jobs. And I love to eat. So in short, as we get older, our body tells us, you know what, need to slow down a little, all right, because you're not young anymore. All right, what's our priority, everybody? All right, among all these things, you want to prioritize respiratory status, right? Because remember earlier, all right, we have diminished breath sounds. It's not here, but it's in the nurse's notes. There is a diminished breath sounds, right? So which means nurses, there might be a possibility of pneumohemothorax, right? I'm going to prioritize that because if there's diminished breath sounds, the lungs may be not expanded. I'll prioritize that. Remember your rule ABC in prioritization. You always prioritize airway, breathing, circulation. You got it? While abdominal pain is also significantly abnormal, it is not a priority at this moment. Okay? Okay? You guys are enjoying case studies? Yes? Yes? Who are enjoying case study? This case study so far. A little tricky. But don't get discouraged if your answers are not matching mine. That's totally normal, all right? With practice, practice makes perfect, all right? What I teach my NCLEX students is first, you gotta improve your content mastery, right? It's hard to talk about trauma if you don't know your trauma complications. It's hard to talk about recognizing cues, right? Signs and symptoms. If you don't know your normal signs and symptoms, or I'm sorry, your normal findings in your abdomen, so you won't also know you're abnormal, right? So you got to master your contents first. You got to master your nursing concepts, your physical assessments, your pathophysiology, anatomy and physiology, pathophysiology, your disorders, your signs and symptoms, and then you move on to do, test taking skills, improving your test taking skills. So that's what we do with Dr. Nurse Paul method. We start with didactics phase. We do a lot of lectures, all right, 24 lectures in didactics phase, and then we move on to neural phase. Neural, all right, phase, we improve your neurons, right? We improve your test taking strategy. So we're not only teaching you lessons, but we're also teaching you how to attack questions correctly, how to answer case studies correctly or more accurately, how you can improve your test taking ability, your ability to understand question, your ability to, answer priority questions, which are high level questions. It can be tricky. Select all that applied questions, all right? Stuff like that. Case studies, next gen NCLEX. We do next gen NCLEX master classes, all right, in our neural phase. And the final phase is called precision, DNP, Dr. Nurse Paul method. Precision phase is your final coaching. It's what we call HIT class, high impact tutoring. At this point, you're already prepared for the NCLEX. You're 1 month away from the NCLEX or 2 months away. We're just giving you last minute tutoring. All right. And then on top of that, we do personalized lessons. So we do a lot of stuff for our students to ensure that they will pass. All right. With me, it's more than money. All right. With me, it's helping you guys pass the NCLEX. Because what you guys want to do was once my dream. All right. Way back 2007 when I graduated and passed my local licensure in the Philippines, I wanted to pass the NCLEX, but I didn't have money. I didn't have resources. I have to self-study. I have to review myself. I have to rely on myself. All right. So it took me a while to really master everything because I don't have resources. I didn't have money. I grew up poor. All right. So I have to do everything by myself. All right. I eventually passed the NCLEX in 2008. All right. That was May 2008. 6 months after I got my Philippine license. And then the rest is history. I'm now here in the US, enjoying my, the life of my dreams. And I want you guys to be able to achieve that dream as well. All right. I am here as a coach. All right. I'm not only here as your instructor, but also to coach you guys about your American dream and stuff like that. You can follow me, Dr. Nurse Paul. That's all I do. Talk about NCLEX, talk about life in the US, talk about being a nurse in the US and all that. All right, but I'm here to help. So when you enroll in Aspire RN, it's not only a business to me, it is my life mission to help nurses like you and students who trust in me to help you guys achieve your dreams. All right, now let's look at this. There's new nurses notes. All right, at 10 o'clock, so 9 o'clock, we have these symptoms earlier. At 10 o'clock, 1 hour later, client is diagnosed with splenic laceration and left-sided pneumothorax. I told you guys. So there's splenic laceration and left-sided pneumothorax, right? Now, what are we going to do? Look at your question. We are now on question number 4, all right? Generating solutions. For each potential order, click to specify whether the potential order is indicated or not indicated for the client. All right, this is called matrix. All right, we're just gonna choose between indicated or not indicated. All right, let's answer. This is straightforward. You guys help me. All right, you put letter I for indicated and letter N for not indicated. Okay, how about IV fluids? Indicated or not indicated? Come on. Indicated or not indicated? Come on. Indicated, not indicated, indicated, not indicated, indicated, of course, because we have trauma, right? So we need IV fluids. We're possibly going to give bolus fluids. We're possibly going to give blood transfusions later on because of low H&H. So we need large bore IV, at least 2 IVs, so we can start those fluids and blood if we need to. Do we need serum type and screen? Every trauma that we have here in the States, part of the guideline is to get H&H, correct? Get your type and screen because there's a possibility that you're going to do, right? Going to do a blood transfusion. In fact, we have mass transfusion protocol here in the States where we don't need type and screen sometimes, depending on the situation. But for the most part, you still want that type and screen. If I'm gonna poke a patient in the ER, I used to work ER. If I'm gonna poke them with large bore IV 18 gauge, 20 gauge, I'm also gonna draw blood, right? At the same time. So I collect my blue top, that's for bleeding times, right? We collect our red top or green top for your comprehensive metabolic panel or lights, right? Your Chem 8, all right? We do purple or lavender top for your CBCs. You don't need to memorize this. This is not going to come out in the NCLEX. This is more like a technical skills for ER nurse. But for type and screen, we usually use the pink vial. All right. So as ER nurses, we don't only poke patients, we also collect blood. And when we do that, what we call rainbow, we collect the rainbow vials, which means we collect all colors. All right. Since it's trauma, we need to do a lot of type and screen. Yes, correct, Kuching. It's color pink. And then we put them a band, orange band, to indicate that we typed and screened them and there's a possibility of blood transfusion. Do we need to do chest physiotherapy? All right, percussion, like that. All right, for patients with possible or hemothorax diagnosed, not even possibility at this point. Patients already diagnosed with hemothorax. No, all right, not indicated. That's going to be very painful. You're going to cause more trauma to the rib cage, right? To the lungs. We don't like that, right? Insertion of NGT. Do you want to insert NGT on a trauma? We have a rule in trauma, right? Do not insert NGT unless we're sure there is no diaphragmatic injury, all right? There's no perforation in the stomach, all right? You got what I mean? We're still not sure at this point. This patient has just been diagnosed an hour ago. We haven't even done a CT scan, correct? I am not going to put an NGT because I don't know if there's diaphragmatic injury. That NGT might go into the peritoneum. You know what I mean? That NGT might go into the lungs. That NGT might go somewhere else, correct? We're not going to do NGT right now. Very good nurses. Very good. Pretty smart. I love it. I love it. Very interactive in the Facebook side. And also someone joined us from YouTube. Thank you. All right. How about administration of prescribed pain meds? Administration of prescribed pain medication. Do you want to give pain meds for your patients? Is that the fifth vital signs, right? Because when they're in pain, they're uncomfortable, right? It's just a horrible experience for patients when they're already having trauma complications and they're also in pain. So kind of give them pain meds. That way they will be more comfortable. They're not in sympathetic crisis. You know what I mean? They're already having hypovolemia plus all these sympathetic fight or flight response because of pain, because of hypovolemic shock. It's really not comfortable. So let's give them pain meds. That's definitely fifth vital sign. So we want to give that to patients so they're comfortable. All right, very good, nurses. Question number 5. All right. Question number 5 is about surgical safety. All right. Your responsibility as a nurse. Think of it as you're a perioperative nurse. All right. Which action should you take? Select all that apply. As a perioperative nurse, what are you responsible for? Can you mark the surgical site? Number 1. Sorry about that. I'm losing my voice. Can you mark the surgical site? Anyone? Thank you for those who just joined. If you just joined, tell us where you're coming from so we can feature you. And we're still waiting for some students to answer. Thank you, Mark, Leo Mark, for being the first answer. And honestly, guys, I want to thank you for following me, all right? I know recently I haven't been posting a lot. Like I said, in the last 3 weeks that I didn't have work, I was in between jobs because I was waiting for my new start date for my new company. But I was actually still teaching, all right? I have 2 jobs, Aspire RN and my nurse practitioner career. So in the nurse practitioner career, I just started a new job, bigger offer, right? Better opportunity, if that makes it clear. But Aspire RN, I still teach about 2 to 3 times a week, all right? Thank you for following me, guys. I've not been very active in social media. If you guys seen, I just do live streams, but I'm not even posting reels. I'm not, because I don't have time to record. I'm not a full-time influencer, all right? And there are other priorities. Family, I clean my house, you know, spend a lot of playtime with puppies because I've been so busy this year. All right. But anyway, so you realize social media is not the only thing that you have out there, right? So don't get caught up too much with social media. But I still admire you guys for, thank you. I appreciate you for following me and constantly participating in my online shows and live streams. My puppies are here. All right. Mark the surgical site. No. Provide clients with ice chips. No. What are your answers? Tell me your numbers. You're not going to put an X mark on the NCLEX, so I'm going to delete that. We're not going to put an X mark in the NCLEX. All right. Provide clients with ice chips. We'll put the patient on NPO. So we need to reduce the risk for aspiration from anesthesia. So we're not going to do that. Perform med reconciliation. Yes. Guys, med reconciliation is just putting all medications that patient's taking. Yes. That's for medication safety. Every nurse at every level, especially in ER, we need to do it. In the floors, you need to do it. In OR, you need to do it. Every time the patient switch from one unit to the other, it doesn't matter if they've been admitted, all right? Today or yesterday, if they switch units, you got to do medical reconciliation, all right? What is that for? To identify if there are interaction with meds. What if the patient has allergies, right? What if the patient is taking, for example, Eliquis that could interact with one of the medications we're going to give in the perioperative scene, right, or situation. You know what I mean? And here in the States, we heavily rely on computers. If you do your medication reconciliation, the computer will tell you, hey, if you give this medication and the patient is taking this medication, it will interact. It will cause bleeding. It will cause prolonged QT. It might cause tachycardia. It might cause allergies and anaphylaxis. You know what I mean? It's called clinical decision support. Your computer will tell you if there will be a problem. But if you don't put it in, then the computer will not be able to tell you. You guys agree? Yes or no? So is it important for nurses to do medical reconciliation? Doctors are responsible for it. Nurses are equally responsible for it. All right? Is it important? Again, let me just highlight that because a lot of people didn't answer it. Is it important to do medical reconciliation? Yes or no? At all, every time the patient transfers, ER to OR, ER to floor, floor to ICU, floor to OR. All right? We need to do medical reconciliation. You got it? Make sure that we have inputted everything that the patient is taking. That way, it becomes so much easier to identify interactions, especially if they're going to have anesthesia and antibiotics during surgery. All right? Or they didn't hold Eliquis long enough. Very good pitching. Eliquis, this is one of our anticoagulants. DOACs is what we call it, direct oral anticoagulants. That has a lot of interactions. Eliquis, warfarin, apixaban, Xarelto, right? Rivaroxaban. Lots of interactions. So you want to put them in. And not only that, there's other meds, antivirals, right? Antiretrovirals for AIDS. What else? Your antifungals, right? Some of your heavy antibiotics, lots of interactions there. So you want to put it in, right? That way we're giving we're providing meds in a very safe manner. Or is that what I said? Obtain consent for surgery. No, that's for the doctors, right? You do not obtain consent. That's for the doctors. All right? We need to witness them signing consents from the docs, correct? Insert peripheral venous device, yes. Consent, no, that's for the doctor. You just make sure that the patient signed the consent, not obtain, because obtaining is for providers, right? Inform client about risks and benefits. Can you do that? Yes or no? Yes. So for example, you tell the patient, okay, we're going to do an explore laparotomy, open lap, right? Or whatever, open explore lap, whatever. Because there's possible splenic injury. And the patient asks you, so what are the risks? What are the risks? How many percent of people who do this surgery die? What are the complications? If I survive today, what are chronic complications? Am I going to be chronic anemic because I lost my spleen? Am I going to be chronically having hematologic issues? All right. Am I going to have peritonitis? Can you guys explain that? What if the patient asks you, how are you going to remove spleen? How many percentage of the spleen? Are you going to remove the blood vessels around the spleen? Guys, you're not going to be able to do that, right? That's very specific to the surgery. That's for the surgeon. Don't explain risks and benefits. What you want to know is if the patient understood the risks and benefits, correct? So after the doctor comes into the room, I go into the room and say, did you understand what the doctor said? Yes. What surgery are you going to do? Right? Do you know the complications? Would you still have questions about the surgery? Did you guys understand? I want to make sure that the patient understood the instructions, the risks and benefits. But I'm not going to explain it. If they have questions about surgery, I'm going to call the surgeon. All right? Assess the client's previous experience with surgery and anesthesia. This is responsibility of surgeons and anesthesiologists, but you also want to consider that because this is mainly talking about previous allergies to meds, right? To anesthesia meds particularly. Did they have malignant hyperthermia in the surgery in the past? Did they have contrast procedure complications, right? Did they bleed during surgery? Did they have a VTAC, VFib during surgery, right? Were they non-compliant to meds and they're still taking their bleeders and they bled and coded in the past surgery? So I'm just gonna document that as a nurse. You got it? It's also responsibility of the providers, but I'm also gonna document that because that's a part of my assessments. Remember, when we're doing assessments, we're also talking about their history, right? Previous history, previous hospitalization, previous surgeries, previous complications to surgeries, right? Ask the client's parents to wait in the waiting room. Is this a minor? Yes. Do the parents need to be there to sign consent unless the child is emancipated? Yes. So my answers, guys, are 3, 5, and 7. All right? We're not going to answer number 8. You guys agree? You guys agree? Yes or no? Yes? 3, 5, and 7. All right? Any more answers than that? If you've answered 6, you answered 4, you answered 2, you answered 1, you answered 8, you get a deduction. So in short, you can have 0 score from answering too much. Be very careful with select all that apply, okay? Because you can have deductions. You will have deductions, all right? So I'm just trying to clarify, okay? If you see SATA, don't answer as much as you can, all right? Because if you answer too much, you're also going to get a lot of deductions, all right? There is a tendency for you to see, oh, there's 8 options. The answer is probably 5 or 6. No, there could be 1 answer or 2 out of 8. You know what I mean? It doesn't matter. It's not going to tell you how many answers there is for select all that apply. All right? But answer to the best of your ability. Do not guess. If you're just guessing, well, you're going to get deductions. All right? Be careful. That's why somebody asks me all the time. Someone asks me all the time, how do you answer SATA? How do you get good with SATA? Then you study your contents first, right? It's hard to answer SATA questions if you don't know what the question is talking about. You got it? There is really no other way to master SATA but to master your contents first. You got it? Okay, final question. Let's just go straight to the question, evaluating outcomes. Click to highlight findings below that indicate worsening of client status. Obviously, we cannot click and highlight because this is a PowerPoint slide, all right? But tell me, what are the abnormal findings? Let's look at the first, because we're looking for worsening, all right, of client status or emergencies. Abnormal findings indicates patient's not doing good, right? Not getting better. Let's go sentence by sentence. First sentence, client is post-op day 3 after splenectomy and is able to ambulate in the corridor 3 or 4 times daily with minimal assistance. Good or bad? Good or bad? We're day 3 already, and patients already able to ambulate with minimal assistance. I don't think there's a problem here. Correct? First sentence is okay. Agree? All right. Second sentence, client has clear breath sounds, a left-sided chest tube in place attached to a closed chest drainage system. I don't think there's a problem in second sentence. Right? Third sentence, tidling of the water chamber noted on deep inspiration. Is that a normal finding? Tidling in the water chamber? Yes or no? Yes. You see that water chamber? There's a letter T. Water, right? Water. Letter T is titling, which means it's a normal finding, oscillations, fluctuations. Titling is normal. So that's good. Let's go to the next sentence. Client refuses to use incentive spirometer, stating it causes left-sided pain. Good or bad? We're looking for worsening symptoms. Bad. I'm gonna I'm gonna highlight that. All right. So in the actual NCLEX, you're just gonna click that and it's gonna highlight it yellow. But since we don't have it here, I'm just gonna underline it for you. Got it? Why? We need the incentive spirometer to reduce the risk for atelectasis, right? Right? Incentive spirometer allows your lungs to expand well. Everybody with post chest surgeries, abdominal surgeries, you need those incentive spirometers, all right? Because if not, they're gonna have pneumonia, they're gonna have atelectasis, right? So we don't want that. Okay, how about next? Client is using PCA, prescribed controlled, patient controlled analgesia device maximally every hour and continues to have intermittent nausea and vomiting. All right, is already using maximally, but patients still having nausea and vomiting. So looks like patients still in pain. I'm gonna underline that. All right, because if you're already using your max dose of opioids, right, your pain should be controlled, right? You should be comfortable. You should not have nausea and vomiting. So two things are happening here. Either your pain is not controlled or you're having overdose from opioids already because opioids can cause nausea and vomiting. Agree? So I'm going to underline that. How about the next option? Adequate urine output. That's normal. I'm not going to underline that. All right. What else? Abdominal surgical incision is intact, or dressing is clean, dry, and intact. No erythema, edema, or drainage. That looks positive. Correct statement, which means normal. So how many answers did we select? We got two answers, right? So 2 points. All right. If you answer too much, you also can get deductions. Highlighting questions is right minus wrong. All right. Minus, what did I do? Right minus wrong. All right. Right minus wrong. So guys, and if you're not familiar with NextGen, I did a lot of classes in YouTube before to tell you guys the different types of questions. So today we did matrix, select all that apply, highlighting questions, drag and drop. There's tables, there's multiple response or SATA matrix, all right? There's select and there's multiple choice, there's drop down, drag and drop, lots of different types of questions. Bow ties, all right? I'm probably going to do bow tie next month, all right? We're going to do bow tie questions. But anyway, who enjoyed the class today? I'll be wrapping up. Started a little bit late. And if you guys are interested to join my NCLEX classes, we are doing our classes virtually. My headquarters, I'm homed here in Houston, Texas. This is where I live. My office is in Houston. All right, but I have students all over the world. My main operations team are in the Philippines, but we have students from over 40 countries. All right, Filipinos majority, but we also have a lot of non-Filipinos. All right, from South Asia, Sri Lanka, Nepal. All right, Malaysia, Thailand. We also have students from Ghana, from Nigeria, from Kenya, from South Africa. We have students from Europe, from Greece, from Italy, from United Kingdom. We have students from Caribbean and South America, Jamaica, Brazil, Argentina, from Canada, from Australia. We have partners in Australia as well. Thank you for those who are trusting Dr. Nurse Paul and Aspire RN. Please message me if you guys are interested. We are NextGen NCLEX ready. We do a lot of these case studies for our students. Big birthday sale again for my birthday this month. All right. It's actually this weekend. So I'll be celebrating my birthday with you guys. Stay tuned because I'm going to have a live stream during my this weekend. All right. I'm going to announce it in my Facebook page. But we're going to have live stream, lots of prizes. I'm going to raffle NCLEX, IELTS courses, UWorld, All right, tap send credits and more. I'm still working on more prizes. All right. I'm also gonna award NCLEX eligibility fees. All right, for one lucky student. All right, so that's it. Lots of prizes for my online birthday, virtual birthday party this weekend. This is the first time I'm doing it because it's the only birthday party. It's the only birthday that I didn't travel, right? So, but I'm gonna do a virtual birthday celebration. We're gonna do a lot of raffle. If you guys are interested, we're gonna do that, all right? So, big birthday sale. All right, 60% off, $220 only. And yes, you can. Thank you everybody for joining. And this is recorded. This is going to be available in Facebook and YouTube. Do me a favor after this class, tag your friends in the comment section so they can see this if they are not available to watch it today because they're either working or sleeping, depending on their time zone. All right. Maria Howell is joining us from North Cotabato. Wow, all the way from the Philippines. Thank you for joining. I love virtual setup because I can reach so many nurses at one time. All right. Um, it's global, which is good. And thank you guys for joining me. Message me if you guys are interested with my raffle. I think it's only until tomorrow, but and Leo is also in Cebu. Anyway, my raffle is only until tomorrow. And in the future, we're gonna do more classes. All right, tell me what class you guys want to do. As long as it's within my expertise, I'll do it. I do a lot of pharmacology classes, EKG classes, medical surgical nursing. However, some of my classes are long. When I do class with my students, it's 4 to 5 hours. So it's really not appropriate for live stream because that's a very long class. It's a full class. For live stream, it's about an hour or two probably. But that's about it. Join me in my future classes. I'm gonna post the raffle link again for today. We're gonna have a raffle. We're gonna be having an NCLEX winner today in my exclusive broadcast channel in Facebook. All right, exclusive broadcast channel. You have to be members of that. There's no fee. There's no subscription fee. I'm not those influencers that have subscription fees. All right, but that's it. So I'm gonna post it there. If you don't know my channel, go to my Facebook. It literally says there, Facebook channel, and then you join that. All right. If not, I'll post a link today. All righty. Thank you, guys. Thank you, everybody. I appreciate your time and thank you for being patient with me as I went through a lot of connectivity issues this morning and started late. All right. Thank you and have a great week. I'll see you guys this weekend for my virtual birthday party. Bye.